Are you wondering what other options you have for your nighttime stretching portfolio? Let's dive into learning about the DASS AFO and how it can help you and your patients. The DASS AFO, with DASS standing for Dynamic Adjustable Stretching Strap, is a lightweight and custom fabricated AFO. It has a molded inner boot to maintain our proper alignment, and it is fully lined for comfort. The DASS AFO has a ratcheting system that is located on the lateral side of the AFO. And the way that it works is we increase the amount of tension by lifting up this buckle right here to ratchet up on that strap and increase tension. To release all of that tension, all we have to do is look for this button in the middle of that buckle right here, press it, and push the foot down into plantar flexion. Being able to remove all of the tension really easily will help you and your families with donning and doffing. On the inside of the DASS component, we have a number scale from 0 to 9. With the higher the number, the harder and the further we are pushing. Below the ratcheting strap, we have our dynamic tension band. So the material properties of this dynamic tension band allow it to stretch, which is really useful because sometimes kiddos get muscle spasms or they need a little bit of a relief. So what happens is they're allowed to stretch into that plantar flex position, but as soon as their muscle relaxes, that dynamic tension band will pull their foot back up. Posterior to the DASS component is our dual adjustable joint. So you might be wondering, well, do I need this DASS component on both the medial and lateral sides? Well, we just need it on that lateral side because of this dual adjustable joint. So it's made out of metal, so we don't have a lot of play in that transverse or in that coronal plane. So we're making sure we're getting that stretch in that sagittal plane. Because of the structure that this dual adjustable joint provides, we can use a lighter weight plastic, which makes it more comfortable for the patient. There are some set screws on either side of this dual adjustable joint, so we can set our range of motion limits in dorsiflexion and in plantar flexion. So if you set a stop in dorsiflexion, say at 20 degrees of dorsiflexion, that is as far as the AFO can go, and also gives parents an idea of how far we are trying to go, almost like a finish line for their treatment plan. To adjust these range of motion limits, make sure that you loosen these 5 screws here first, then set your set screws, and then retighten these to set your limits. So on the medial side, we have our goniometer joint or our Goni-Joint. So as our dynamic tension band scale shows us how far and how hard we are pushing, this Goni-Joint tells us what our movement and our current range of motion is. Having both our range of motion listed here and the adjustability with that dynamic adjustable stretching strap allows us to make sure we are getting the maximum benefit out of this AFO. For this Goni-Joint, you want to make sure that you have marked a reference line for where 0 or neutral is. That way your families and the rest of the healthcare team can correctly use this joint. So now at the bottom, we do have some non-skid tread. So if the child needs to get up in the middle of the night to go use their restroom, or if they need to stand up while they're weaning into the AFO, they'll have some additional friction between the bottom of the AFO and the ground. At the initial fitting appointment, you want to make sure you are donning this on the patient with them lying supine and with their knees extended to simulate what they would be like sleeping in their bed. As you don the AFO and increase that tension, you want to increase it to a level where they're still comfortable, but we are still applying a stretch. Every week or every other week, increase that level by 1. If we end up increasing the level and the child cannot tolerate it, it's okay to go back down a level. And then the following week, try that higher level again. Because of the design of the DASS AFO, which does not have any additional straps attached proximally like other night stretching AFOs, you're able to use it with a knee immobilizer for a full leg stretch. You can obtain knee immobilizers from your preferred distributor. To order a DASS AFO, start off by going to our website, surestep.net, to find the DASS AFO order form. We do take measurements, casts, and scans, and you can find links in the description below.